So let's start the short cases in surgery. So this is a video that's mainly focused on helping medical students to ace their final year examinations. And this video series will mainly focus on short cases, and all third, fourth, and final year students can watch this video and get some idea about the examination. So let's go through the presentation. So in surgical examinations, in when it comes to exams, in all the examination you should be relaxed. So before the start of your short case, make sure that you breathe properly, take some deep breaths, and be prepared for the examination, and listen to the command clearly before the case. So most of the times these days they keep the command printed on a paper and pasted onto a table. So because various examiners may give something command that is different, so students can get false idea, or students can be misled. So because of that, these days in exams, most of the times these commands are printed and pasted. Okay, so read the command carefully and slowly, and in certain cases they would ask you to uh, get a history and then examine. In certain cases uh, they will ask you to get a history, and while you get take the history they will ask you to examine. And in certain cases they won't let you get the history from the patient, and they will directly ask you to examine. And in certain other cases you might have to examine first and then get one or two questions from the patient uh, to complete your examination. So in surgery short cases there can be two types of cases. The first variety is mainly it's three types. So correct this, be three types of cases. So the first one could be short cases. I'll explain you what those are. And some are long short cases, and some are spot diagnosis. So short cases are mainly the lumps, lipoma, those kind of things. Long short cases are something like thyroid examination, varicose vein examination. These examinations might uh, take some time, so you might have to spend a little more uh, amount of time to complete these examinations. So it's a mixture of short cases, long short cases, and certain spot diagnosis. Something like a tumor, arterial tumor, or gangrene, amputee. So those things are spot diagnosis. And before the examination, always be cautious about privacy of the patient. So always remember that you maintain the privacy of the patient. And before examining, as you already know, get the consent from the patient. Just a short consent will be enough. And make sure that there's adequate lighting in our ward setup. Mostly the lighting is not that adequate, so make sure that you have adequate lighting before examining the patient. And always don't forget your basics. So basics in the sense, when you're examining a patient, first of all you have to do the inspection, then you palpation, then percussion, and then auscultation. Okay, so most of the surgical short cases might not involve auscultation. Unless it's a thyroid, you auscultate for bruit. Okay, so in thyroid cases, or in something like a cervical rib, again you auscultate for bruit. Okay, or in certain cases like AV malformation, again you listen for bruit. So other than these certain cases, most of the time it's only inspection, palpation. Those are the two main components in surgical cases. Percussion also you won't get. And the next part is sequence should be in surgical short cases. First the specific examination, then the loco-regional examination, then the general or systemic examination. So specific examination sense in the sense, so let's say the examiner wants you to examine an venous ulcer. So first of all, you do the ulcer examination, you describe the characteristics of the ulcer, and then loco-regionally, in the sense you just go beyond the ulcer and you see whether there are any skin changes around the ulcer, and you inspect the groin area and palpate for inguinal lymph nodes. So all these are loco-regional examinations. And then if it's a venous ulcer, then you have to carry on with the general or systemic examination. And let's say it's an arterial ulcer, so first of all you do the arterial ulcer examination, and then loco-regional examination, in the sense you have to feel for the pulses, you have to see for changes around the skin due to peripheral vascular disease like shiny skin, loss of hair, those kind of features. And then for the general or systemic examination, you might have to offer the examiner that you have to examine these systems, like cardiovascular system, just to complete your examination. So something like that. And always it's nice to request something at the end of the examination, something like, so let's say you are examining the scrotum of a patient, and at the end of the examination you ask the examiner that you want to examine the abdomen to see for abdominal masses, free fluids, just to complete your examination. So this might add some more marks to your case. And in organs that are found bilaterally, always inspect both sides. So you have to compare both sides, like in a breast or upper limbs, lower limbs. In these cases, if there's a pathology in one side, you have to examine the other side and compare both sides. And when examining the upper limbs, always keep them on a pillow. Most of the times you will be given a pillow, the patient, so keep them on a pillow and examine them. And in these cases, always remember to inquire about the occupation and the dominant hand of the patient. So mostly, let's say you are getting a carpal tunnel syndrome case, and in that case you have to ask whether the patient is right dominant or left dominant, because this might add value to your management. So we'll discuss more about it when we go through the lecture series. Next of all, and always when you're like doing your examination, please don't hurt the patient at any cost. So don't try, if there's a tender lump, ask them whether it's tender, if there are any signs of inflammation. Just tell the examiner that the patient complains of pain, so you don't have to like proceed with the examination. So, and then once you complete your examination, always remember to thank the patient. So examiner would be like, though it's not a very good thing to say, he will be judging you throughout your short case. For this 20 to 30-minute period, he will be judging you. He will see whether you are a good student, bad student, or excellent student, outstanding student. So these might add some more marks to your cases. So always remember to thank the patient. So when those are the things that I have to say in the introduction of this video. And in the upcoming videos we'll discuss some common short cases that you may encounter in your final year cases, so which are mostly the lumps, ulcers, hernia. Mostly you will get a hernia, and commonly it's inguinal. And you will get breast examination, so it could be a female or a male with gynecomastia, so both can be given. And post mastectomy patients can be given scrotal examination, varicose vein examination, carpal tunnel syndrome patients. And you may also get a couple of orthopedic cases like patients with casts, patients with back slabs, patients with external fixators, and certain other miscellaneous cases like tubes and drains, IC tubes, external biliary drains, and stoma. So that's all I have to say during this first video. So I'll see you in the next video. Thank you.